what we're doing here is basically popping a little blood pimple. Larger spider veins, after we treat them, can collect old blood, and the body will absorb it and it'll go away, but it could take up to a year, and it's kind of not the prettiest thing. And so what we do is we take a small needle, and I'm just pushing. See, it's very dark, and in medicine we call that, quote, old blood, unquote. But it's basically deoxygenated blood that is very, very dark. Oxygenated blood, of course, is bright red. Anyway, it's just blood that's collected in these spider veins. You know, when spider veins are neglected and have been someone's friend for a very long time, then they get to a size where when we treat them, they're just going to collect blood like this, and we could leave them alone, but it's just going to take a lot longer for these to look better, because the body has to eat this old blood up one white blood cell at a time, and so it could take months for that to happen. And so we just accelerate the cosmetic outcome by pushing some of this old blood out of there, and so she'll look better a lot quicker. So that's what we're doing here.
What's this one called?
This is called, well, the fancy name's incision and drainage, but I like calling it popping a blood pimple, because that's basically what it is. Anyway, Sandra, could I get a little more alcohol there? I'm going to do maybe a few more. She'll let me. Again, it just accelerates the cosmetic improvement. Pinch. See a little bit of that dark stuff come out. And again, this is kind of graphic and gross, but she's not yelling or cussing at me. She's not flinching. She hadn't got up and walked out yet. So anyway, just being gentle. But yeah, this is probably as graphic and gross that spider vein sclerotherapy is going to get, and this is relatively uncommon that we have to do this, but I started out by saying she was kind of the worst of the worst. She had ginormous varicose veins, thrombosed varicosity in here, and so she's got, you know, some quite large veins that have just trapped some blood. And she's a former actress, it sounds like, and good looking lady, so we're trying to make her look good as quickly as possible. Accelerate the body's normal healing process. So anyway.
Oh, music.
Oh, music. Oh, yeah. Oh, I'm so glad I did that. Because what that's going to help, again, is make this just look better, faster. See a little dark discoloration on the skin, and what that is the iron in the blood kind of, well, the blood seeps out of the vein after treatment, and the iron in the blood stains the skin a little bit of a rust color, and 99% of this rusty color is gone at 1 year, but who wants to wait a year for this to go away? So anyway, you can see it's kind of like this gloppy jello-y like substance. Now, this isn't, I should clarify, this is not a spider vein that we're puncturing here. This is a vein about the size of my pinky that we previously treated with ultrasound guided foam sclerotherapy, and it's just got some old blood that's trapped in it, and it's got a little discoloration over the top, and so I'm just trying to, again, accelerate her cosmetic outcome really by doing this. She hasn't complained about any of these dark colors, and as I explained a little earlier, a lot of her dark colors were already there to begin with. When you ignore vein disease, this discoloration will develop on its own. So anyway, yeah, this will.
Well, there was another one of those, and the last time you did it, then it went away.
Yep, and so she's talking to me. She's not cussing, thank God. But
Cosmetic Botox hurts worse.
there you go. Vein treatment, a walk in the park. Actually, doing a laser treatment in some of this foam is what I sometimes describe as like driving through a slow McDonald's drive-through. It's really doesn't take that long. Actually, one of our taglines is 30 minutes to your best legs ever. It might take a few 30-minute sessions, but we can easily reverse a lifetime of vein disease on a lunch, 30 minutes. Easily do that. So anyway, I'm going to let Sandra tidy her up here, and she's done real well, and we really appreciate you participating in this today. Vein911 is very well represented at our website, where there's tons of information, video links, pictures, all sorts of information, but we're also on Facebook, on YouTube, on Twitter, and on LinkedIn, and we have all the information you can possibly desire. If you do your homework and you're a recovering detail person like myself, or not, or just like a little bit of details, I think if you do your homework, you'll come visit us at Vein911. Come and see us.